And so I think what I'd like to hear from the panelists, in whichever order you choose to answer, what do you see as some of the most impending challenges for the LGBT community going forward?
I think what's happening now is that we're learning more and more about the severity and depth of the problem. And in our community, not just lesbians, but the whole LGBT community, we have increased cancer risks, none of which are the product of biological or genetic differences, but behaviors, many of which can be traced back to the stress and stigma of living as a sexual minority, coupled with decreased screening rates, meaning that we are underutilizing the healthcare system and not being screened for cancer. It would seem to me, because in every other part of my life, 2 + 2 = 4, that increased risks coupled with decreased screening rates has to equal a greater incidence of cancer, and I would also imagine, make it 4+, cancer detected at a later stage when the prognosis is worse and the treatment is more difficult and complicated. But because no national cancer registries or surveys collect information about gender identity or sexual orientation, we remain hidden within that data. And the reason this is critical is that that data is necessary to develop real prevention programs and treatment programs and get funds.
It's not like everything is the same, but much of it is the same, and we're still not counted. And it's not just the lesbians, it's the LGBT. And when Liz was saying not just sexual orientation, but gender identity, I think it's very, very important to acknowledge that. We are trying to make some changes as activists, as the professional LGBT health movement, and to have impact both in Congress and in the House, so that we will have changes in legislation. It is very slow, and in the last 8 years of the Bush administration, I have to tell you that we practically had to fly under the radar in order to get anything done. And if I would write a grant that would want money for lesbian health, then they would say to me, so where's the data? But I said, but you don't count us, so how can I have the data? The data is my gut feeling. It's the anecdotal information that I have from the women that I serve in my organization, but I don't have the questions on the national census to get that data. So I say, well, then we can't give you money.
Not only are we not out to our clinicians, and our clinicians are not asking, but I think that we sometimes lie because it's easier to lie. My partner recently was admitted to the hospital with critical conditions in an accident, and I had to have my doctor give us a note so that we went to the emergency room and it would be a big question. But every single person I had to say, we're partners. She's my partner. She's my partner. She had to say, she's my partner. And she was in horrendous pain. She was very, very ill. She was admitted in critical condition. But we had to do this every step.
When you talk about health and well-being, I want us to look at a much larger picture. It's not just our body, it's our psyche, it's our souls, it's our emotions, it's our community, it's how we interact with each other, how we are in partnership and how we are in community. And is there a community?
I just want to add to that. There have been some small studies of lesbians, and two things. One, they're small. Sample size is small is what I mean, and the results have been contradictory. But there are some facts that are shown over and over and over again. For example, that LGBT people use tobacco at up to twice the national rate. But can we say that increase in smoking translates into greater incidence of lung cancer? No. But we do know that. And there have been other studies, again, about like alcohol use, etc. But no one's really, the results of looking at, are lesbians really at higher risk? No, we don't really know that.
The major risk factor for breast cancer is having a breast. Yeah.
Right, and age.
And age, yes, but age and the fact that you have a breast.
But more and more young
No,
women are getting
I would
breast
want
cancer
to
too.
contradict the point of age. We're now
Yeah,
seeing
that's
more
right.
and more younger women coming down with stage 3, stage 4 of breast cancer. So, the myth of starting mammography at 40 and then on, the standards of care in medical are beginning to change.
You're right. But one of the reasons that we're starting to see younger women in the 30s and 40s is because detection is so much better.
Absolutely. Well, that means it's there.
Exactly.
We just didn't know
We just didn't know it before.
But we're not seeing it in certain communities.
No,
We're not
it's
getting-
across the board.
We're because we know that among women of color, detection is much later, and as a consequence, the cancers are much more invasive and much more progressive. But one other point, Nurit, is that girls are hitting puberty much, much, much younger now than they were 20 years ago or 40 years ago, and that is also significant.
But I think we're sort of skipping over the fact that brings us here today, which is that regardless of age that puberty starts, regardless of what the recommendations are or advances in detection, lesbians as a group are underutilizing mammography services. And I think many butch women have never had a mammogram, and I think that, or a clinical breast exam, although even those are questionable now. But I think what we should be doing as a people, I mean, we're all working in the ways that we can, and my organization is working to try to train healthcare providers to offer more culturally sensitive, welcoming, respectful care. But I think what we need to do is help each other. If you love her, get her screened. That we need to encourage everybody we know to get all the cancer screenings that are shown to make a difference. Not just mammography or breast screenings, but also colonoscopies, for example.
We need to keep at it. I think we need to keep putting ourselves out there. And and when you were talking about domestic violence, this is one thing that if we don't keep doing it, people are dying. And I know.
Our people are dying.
Yes.
Our people are dying, but
This is a taboo that nobody talks about or wants to talk about. Our power. And the more of us demand access, the more of us demand compatible, comprehensive care, then we will get it. If there is a critical mass, then it will happen. This is how it works. And you know what? The people now realize that the LGBT population are a very good economic force. So now they talk to us. And if they talk to us, we need to tell them what we need. And we are a force to reckon with. There are so many of us. And if we start coming out and if we start demanding the rights that we have, nobody can stand. It's a tidal wave. And marriage and all of that is going to come whether they want it or not, because you can't stop it anymore. It's not stoppable.
Any last questions? Comments? Any last comments from our panel?
Thank you all.
Thank you.
Victoria, Liz, Judy, Nurit,